Today on Thoughts from a Therapist, I want to talk to you about diagnosis. If you're new here, my name's Stephanie. I'm a licensed mental health counselor and I bring you daily thoughts from a therapist. Diagnosis is so tricky. So, if you're going to see a therapist and you're utilizing insurance, then the therapist is going to have to set some sort of a diagnosis in order for the insurance to accept the treatment. So, they're going to put in this diagnosis, and this is going to describe your symptoms, hopefully, have a good fit, and be sent off to the insurance. In other settings where maybe we're not billing insurance, the diagnosis isn't as important, it's not necessary in all situations. It might be assigned, but whether it's like a bigger thing is usually unlikely. Now, when I work with patients myself, I often will complete the diagnosis and treatment plan, and it'll have all the symptoms and why I'm seeing what I'm seeing. And I will send it to them and open it for questions. If we have conversation, if we have a question, please ask so that you have an understanding of what I'm seeing, especially if you don't agree with what I'm seeing. I think it's important to kind of have that open conversation about what I'm experiencing and what you're experiencing. On the other hand, sometimes people find diagnoses to be really tricky. It becomes a label. Sometimes people really struggle to separate that from self and make it kind of part of their identity. You are not depression. You are not depressed Paul, like I said in one of my lives. You're a person who's maybe suffering from symptoms of depression or from depression. And so sometimes people really struggle with having that assigned label. Usually in therapy, it's something that we work towards. Is this something that we need to discuss? How do we conceptualize this label and how do we make it make sense? Let me know your thoughts.